Hello, class. It's Miss Moran, your instructor. Step-by-step, chapter 5 deals with specific guidelines for chapters 1 through 10 in the ICD-10. So chapter 1 deals with infectious and parasitic diseases. And these diseases are classified according to the cause of disease. And we do have some combination codes, which is one code to fully describe more than one diagnosis. B37.0, candidiasis, infection of the mouth, is an example. Multiple coding is 2 or more codes are necessary to describe a diagnosis. Like, for example, N39.0, and you would need to use B96.2 E. coli to fully describe this particular. Resistant infections and sepsis. An example of that is multi-drug resistance. Mycobacterium tuberculosis, for example, is resistant to antibiotics. There's some exceptions. MRSA is an exception. And MSSA, methicillin susceptible Staphylococcus aureus. The first listed diagnosis will be the infection, followed by the Z code for the drug resistance microorganism. We have sepsis, severe sepsis, and septic shock. So you can read about the difference of those in your step-by-step book. Remember that we have to report the infection followed by an R code, R65.2. Septic shock is a circulatory failure associated with severe sepsis. Code the infection first, followed by an R65 category code. HIV infection includes AIDS, positive serology or culture. You can have that, but no symptoms. So you would report Z21, asymptomatic HIV status. Exposure, but not positive. Z20.6, contact or exposure. Inclusive serology is R75. It's used for newborns of AIDS mothers. HIV testing, you would report Z11.4. Encounter for screening for HIV. Additional codes for high-risk behavior could help identify, for example, high-risk heterosexual behavior, high-risk homosexual behavior, high-risk bisexual behavior. And we move on to chapter 2, neoplasms. We have malignant and secondary. We have cancer in situ, which is not invasive, and we have benign, and we have uncertain behavior. Benign is not malignant. And then we have unspecified behavior. We have stages of neoplasm. Stage 1, the tumor, for example, of the kidney, right? Stage 1, tumor of the kidney, the capsule only. Stage 2 will be invading the renal capsule. The stage 3 is going to be extending to regional lymph nodes. And stage 4 will be spreading out to other organs called metastasis. The pathology report and staging information will be documented in the medical record. Sequencing and complications. The treatment for neoplasms would be if, for example, if the treatment is directed at the primary site, you are going to sequence the primary neoplasm first. If the treatment is directed at the secondary site, that's the metastatic site, you're going to code the metastatic cancer first. We have types of treatment: chemotherapy, immunotherapy, radiation therapy. If there are complications, we sequence the complications first. So, for example, Z85, personal history of malignant neoplasm. This is for a patient who has had that neoplasm, but it's been eradicated and it's no longer active. There's no active treatment. Uh, if the patient is receiving chemotherapy, we cannot use a personal history code. Chapter 3 deals with blood and blood-forming organs, anemia, coagulation. Chapter 4 deals with mainly endocrine and metabolic diseases, like diabetes is a big one there. If there's a drug-induced diabetes mellitus, we use an E code, E09. We have type 1 diabetes, type 2, and other specified diabetes mellitus. The codes are combination codes that include the type of diabetes mellitus, the body system affected, and the complications. For example, E10.21 type 1 diabetes mellitus with diabetic nephropathy. So this tells us the type of diabetes it is and what is going on, what's the complication. So the complication in this case is the diabetic nephropathy. If the type of diabetes is not stated, you're going to have to ask the doctor. Mental, behavioral, neurodevelopment disorders is chapter 5. That deals with drug abuse, alcohol dependence, psychological disorders, mood disorders, such as bipolar disorder, mental behavior, continue, anxiety and stress-related conditions. We have eating and sleeping disorders, adult personality behavior disorders, intellectual disorders, excuse me, developmental disorders, child or adolescent disorders, specified. Pain disorders related to psychological factors. We use a G89 for pain and then F45.41 for pain related to psychological factors. So as you can tell, we need two codes in this type of scenario. If it's a pain related to a psychological factor, two codes. Dementia, we have different types of dementia, as well as unspecified. So let's move on now to Chapter 6 of the ICD-10, which deals with the nervous system. We have a lot of combination codes that we need to pay attention to. We have manifestation codes, like, for example, neuroleptic-induced Parkinsonism. We would have to use an additional code for adverse effects. Then non-psychological pain, the localized pain is reported throughout the I-10. Like ear pain, for example. We have another example, acute pain due to trauma or chronic pain due to trauma. So acute and chronic are always terms that you want to keep your eye out for. Dominant and non-dominant side. So dominant side is right or left-handed. For example, if I'm left-handed, then that would be my dominant side. Paralysis, plegia, is reported based on the dominant or non-dominant side. For example, we have a spastic hemiplegia affecting unspecified side. We have the same condition affecting the right dominant side or the left dominant side, or affecting the right non-dominant side or non-dominant left side. If the dominant side is unknown, report it as the right side. Diseases of the eye does not contain all of the eye and adnexa codes. Chapter 2 excludes two notes, directs us to different categories in the ICD-10, like injury, for example, poisoning, neoplasms. And here's some little bit of anatomy of the eye that we can take a look at. A hordeolum is infection of a sebaceous gland, a stye. It's reported on location and type, right or left upper or lower lid, external, internal, and we have more forms of infections of the eye. You can see as well, you have this in your book. So endotropion turning inward, ectotropion turning outward. The Lagrimal system, there's some codes in category H04 dealing with this system, like a cyst, for example, right and left sides, or bilateral or unspecified gland. Diseases of the ear and mastoid process, chapter 8. Some notes there to keep an eye on. For example, it excludes endocrine and nutritional metabolic diseases, injury or poisoning. So those types of conditions would be coded, as well as the disease from the ear and mastoid process. Neoplasms as well. We have diseases of the circulatory system, chapter 9. Again, excludes notes there, which means you will code, if the condition exists, you'll need 2 codes. For example, like a systemic connective tissue disorder that is included with some condition of the circulatory system. So there you would need 2 codes. We have some codes that include rheumatic fever, hypertension, ischemic heart disease, cerebrovascular disease, hypertension, or I-10. This is a very, very common code that you're going to be using. It includes arterial, benign, essential, malignant, and primary, and systemic hypertension. Arterial hypertension is increased arterial blood pressure. Systemic exceeds the norm for several months. Primary or essential, the cause is unknown. Secondary will be due to an underlying condition. So we have a transient hypertension, temporary is transient, or 03.0, elevated blood pressure without a diagnosis of hypertension. So we have to be careful when we see something like this, because we don't want to give the person a hypertension diagnosis code if it's just a temporary condition. It could be something, hypertension due to pregnancy. So hypertension with heart disease, the code I-11 includes the conditions reported with I-50 or I-51, myocarditis, cardiomegaly, ill-defined or unspecified heart disease, hypertensive heart disease with heart failure. This is another code that you may see quite often. Hypertensive heart disease failure. We would use an additional code to identify the type of heart failure from the I-50 category. So if you have hypertensive heart disease, we have a code for that without heart failure. Hypertension with heart disease, the same heart condition is not stated to be due to hypertension or hypertensive. Report the heart disease and the hypertension separately. So whenever you see the words due to or with, that is going to be one code, but if it's not stated as due to or with or in, then you will need 2 codes. Chronic kidney disease. You have to assume there's a relationship between hypertension and chronic kidney disease. So we have a combination code, I-13, combination for heart disease and CKD. If the heart disease is present, you assign a category I-50 code. It's a little bit small, and you can see that we have codes for all the different stages of chronic kidney disease with hypertension. So if you have, for example, end-stage renal disease with hypertension and chronic dialysis, we have 3 codes there. Myocardial infarction is a heart attack with occlusion of a coronary artery. STEMI, ST elevation, MI is the most severe, total occlusion. And you'll have information about the STEMI in your step-by-step book. I know that you're going to read about that because there's some examples there. So I-21, for example, ST elevation, STEMI, myocardial infarction involving left main coronary artery. Non-STEMI is a less severe, it's a partial occlusion. And then we have subsequent. If it's a subsequent STEMI or non-STEMI, we have an example right over here, I-22.1, subsequent ST elevation, myocardial infarction of inferior wall. This is a subsequent heart attack. The initial heart attack happened already, and this is a second heart attack. And the complications are within 28 days of the initial heart attack, the initial MI. You use a code I-23 category. Arterial septal defect as current complication following acute myocardial infarction. Diseases of the respiratory system, the combination, some of the codes are combination, and they'll show the organism, like a recurrent streptococcal tonsillitis. Some of the codes require separate reporting of the organism, and you will see the notes in the ICD-10 going to say, for example, use additional code to identify infectious agent. And that's the conclusion of Chapter 5. You have a great day. Talk to you soon.